Hey guys, my name is Dr. Manrina Rhode, and today I want to talk to you about transitioning from a dental health check to a cosmetic dental consultation. So how do you go from having a patient come in for a general checkup and bring up the conversation about cosmetic work that they might want to do, and also make the time to actually be able to analyze them and give them a treatment plan for it. So I think a lot of people are confused about that workflow, and rightly so. You know, if you have a patient coming into you for a dental health check, a checkup, and you've booked in half an hour for the appointment, and it takes that much time for you to go through, and you've done your charting and your BPE and gone through your extra-oral, intra-oral assessments, any x-rays that you need to do, and showing them what's going on health-wise in their mouth, then that's going to take up all the time, and there's not a lot of time left to bring up cosmetic treatments. And also, how do you bring them up? Do you say to the patient casually, are you happy with your smile? Is there anything you want to change about your smile? And at the end of that half an hour, when you don't have time to really have that conversation, even if you do casually ask that question, then how do you go through whatever they answer for it? So let's talk about it. I have a smile questionnaire that I've created. I have it within my mentorship program in the resource section. I would be happy to share it with you anyway, actually. If you'd like it, contact my team, please, and they will send it through to you. And what that is something that you can add to your PMS software, to your patient management software, and the patient fills in before they come in. So for example, on Dentally, we use Dentally. On the medical history form, you can add whatever questions you like. So you could ask those smile questions in the medical history. So when they update their medical history every 6 months or every year when they come in, then they're also filling out, do you have silver fillings that you'd like to change? Do you have crowded teeth that you'd like to change? Are you happy with the color of your teeth? Etc. And so you're kind of asking those questions, and you can very quickly peruse through the answers like you do with a medical history. If everything's just no, 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 then that's fine. And Dentally shows you when it's yes. And so those shine out to you, and you know which topics it is that you need to bring up. So in that case, as soon as the patient walks in, you'd be like, hey, thanks for filling out the form. I've seen that you're interested in these different things. Let me do your dental health check for you, and at the end of the appointment we can talk about it in a little more detail. But actually, it'd be great to book enough time to really talk about that in detail and book you in for cosmetic dental consultation separately. So you can also keep that in mind, that if they said they want to change their amalgams, for example, or if they're interested in some in Invisalign or in some clear aligner treatment, then while you're doing their dental health check, you can be having a look and keeping that in mind and saying, oh, there's some tartar buildup around the lower anteriors, but yeah, you said about the crowding that you've got there. Actually, if we align that, that's going to help with that not collecting so quickly for you. And so it allows you to start integrating that into your message, and then at the end of the appointment, you want to make sure that you get your photos. So keeping in mind, scan their mouth so that you could potentially get a clean check ready for them. If you're using Invisalign or whichever platform you're using, get the photos. We've got a full series of photos that we recommend. We have full details about them in the resource section of the mentorship program. And again, if you'd like them, let us know and we'll send them to you. Make sure that you get your photos in. Well, there's a siren going by. And then get your photos, get your scan, get your information, and book them back in. And then when they come back in, you want to book enough time. And that appointment's always going to be a loss leader, right? You're never going to charge as much for that appointment as what your operating costs per surgery per hour are if you're a practice owner and if you're associate, if you even know that. But it's not something that you're doing to make money. It's something that you're doing to give yourself time to build up your book with the type of treatments that you want to do, and give you time to really go through those options with your patient. So then you get them back in, and that appointment should immediately feel different. It should feel like you're not here for a dental health check. We're here to talk about something really fun. We're talking about making yourself look better, and who doesn't want to look better? So you start that conversation with them and have a really good chat about what they told you when they filled out that form, what you think their options might be, how in the meantime you've done some Photoshop. We teach Photoshop within our mentorship, and we have an online course coming out about that. This is what potentially you could do with your smile. This is the clean check we've got ready for you. These are the different treatment options that I've come up with. Really often in my mentorship program, dentists will take pictures at the dental health check. They'll chuck them on the WhatsApp group, and then we'll treatment plan together, so that we make sure that that the dentist is really clear about all the cosmetic options before the patient comes in. So it's nice sometimes to have someone to brainstorm with, because this is what I do all day, every day. It's very easy for me to just look at a smile and be like, you could do this, and I'm so happy to support in that. And then we have our cosmetic dental consultation pro forma, which again we have in the mentorship. We go through it in designing smiles in my veneer course, and you'd have that saved on your patient management software. So we have it on Dentally, and then you go through with your nurse and you answer all the different categories of make sure you're measuring all the important things that they are to mention and measure before you do a smile makeover. And then you've got time to sit and talk to the patient about this exciting transformation that they may want to do, and that's the main thing, right? You've got to be excited about it. It's an exciting thing. No one's doing it because they need to look better. They're doing it because they want to look better, and it's different. So there's an idea, a quick whistle-stop tour of how you could transition from taking your dental health check patients into a cosmetic consultation and doing more of the work that we all enjoy so much.